Hey everybody, this is Dr. Ben Pearl. Today we are going to solve some questions regarding a new therapy that I'm excited about. I brought it into my clinic less than a month ago. It's called electromagnetic therapy. I've got the honor and the luck of running into one of the foremost current authors on the subject. I'm going to let him explain more, but I want to just do a quick intro. His name is Dr. William Pawluk, and he is here to talk to us about the benefits of electromagnetic therapy. He is trained in Canada. He got his degree in medicine at the University of Alberta, and above and beyond that, he got at a University of McMaster's, he got his clinical epidemiology master's. So he's got a good idea of chronology of disease, understanding the longitudinal benefits of applying therapies and the consequences. Welcome, Bill. Tell us, why do we need electromagnetic therapy, and why is the medical community a little bit hesitant to jump on the bandwagon like you and I have?
Well, magnetic field therapy finishes the job, if you will. So what happens is if you have surgery, you're basically relying on the body's own natural ability to heal itself. Usually the surgeon does nothing for you to help you to heal from your surgery. If you have an appendectomy, you're basically left to your own devices, and you leave the office and the surgeon says, come back in 2 weeks. In the meantime, what happens? The body takes care of business. And that's what the doctor relies on. We're removing chance. With magnetic field therapy, we stimulate the tissues to be able to accelerate their natural healing. We optimize the body's ability to heal itself under almost any circumstances. So that's what magnetic fields do. They're passive. They pass through the body completely. As they pass through, they generate energy in the body. That energy is then used by the body for its own purposes, and the body decides what it's going to do with it. The magnetic field doesn't decide what the body is going to do with it. The body decides what it's going to do with the magnetic field.
You said off camera that you like to use the analogy of that we're just basically a big battery, our body. How does the magnetic therapy upregulate the cell permeability in a nutshell?
Well, it regulates cell permeability. Well, first of all, it opens cell membranes.
Yep.
And when you open a cell membrane, it has hundreds of channels, and different proteins and different chemicals and electrolytes and so on pass in and out of the cells. A cell that is damaged or compromised is not allowing those channels to be open, and therefore charge builds up on the outside of the cell. So that cell then becomes sick. So magnetic field therapy then, because it's stimulating energy and charge in the body, causes the cell to now open those membrane channels. The electrolytes re-equilibrate, and that's where the concept of the battery comes in. So when the cells re-equilibrate, the charge becomes reestablished. You're basically then boosting the energy of the body to do the work that the body should be doing and often can't.
And we know that this is not voodoo medicine, because for about, since I think the late 70s, insurance companies have been paying for a form of electromagnetic energy that is strapped on to an ankle fracture for a delayed or non-union, or an elbow fracture, or any fracture that is deemed at high risk. So it's not as if this came out of nowhere. I think the new part of the equation is, wow, this can help muscle recovery. Wow, this can upregulate neogenesis for vascular channels and for neural tissue. You had an amazing anecdote you told me about a 3-year-old. Tell me about that guillotine type injury of the tip of the thumb.
So yes, one of my earliest miracles, if you will, with magnetic field therapy that really caught my attention and continued to drive me to use the technology. The 3-year-old girl basically cut off the end of her thumb in a door jam, sheared it off. And so fortunately, the father called me before the surgeons had at it, what they would have done was they cleaned it up and put a graft on it. They would have covered the wound with a graft. That thumb would have been abnormal for life. So that little girl, the father called me. We said, just reattach that piece that came off. And in a book that I wrote, to Supercharge Power Tools for Health, we actually could see the suture marks, see the sutures. And the tip of the finger is black, and it's purple. It's black. There's no blood supply. She used magnetic field therapy for an hour and a half to 3 hours a day. 12 weeks later, she's regrowing her whole finger, including her nail. So the magnetic field therapy dramatically accelerated the healing process. She did nothing else for that thumb other than applying the magnetic field therapy.
Did the biologic graft, if you will, or the biologic dressing of the covering of the thumb, did that eventually slough, molt off, or as new tissue generated? Was that the process?
Totally. So it became like a scab, essentially.
Yeah.
So as the blood vessels grew into the dead tissue, as they moved from the living tissue, they basically crowded out the dead tissue, and that eventually, as you said, became a scab and just sloughed off.
I do want to say briefly that there are techniques where, given enough speed, with getting an emergency neurosurgeon team together or plastics team together, with loops, they can reconnect the neural tissue and the vessels with, it can't be like a shearing injury where there's too much trauma. It has to be a nice clean cut where they can reattach a segment, and that is able to be viable. The key here, though, is that now we have another tool to give us a little bit of an edge, even if we had that neuro surgeon and that plastics team available that has that micro technique that they're able to accomplish those reattachments.
All they're doing is reattaching. All they're doing is reattaching. They're not causing a healing. The body has to heal it. The body has to take the rest of the tissues that are not nerves, right? And they have to get them to heal and regenerate. And you regenerate by growing stem cells. And that's what PEMFs do. They accelerate the whole regeneration process.
You mentioned a NASA study about
nerve grafts to work.
Well, you mentioned a NASA study looking at petri dishes of growing neural tissue. Tell us about that.
So years ago, in the late 70s, NASA did a study, early 80s, I think, did a study because they were very interested in growing stem cells in space. Right? People go up to space, then they injure themselves. They have to be able to have tissue available to regenerate. So what they did is they put neural stem cells, which are stem cells to grow, in a petri dish, and then stimulated it with 10 hertz magnetic field therapy, 24/7. What they found is that the magnetic field therapy stimulated the stem cells to regenerate at the rate of about 400%. So they increased their regeneration by 400% compared it to control, which did almost nothing. It did something, but not anywhere near 400%. Plus, in addition to that, in that study, they discovered that those stem cells produced over 140 growth factors. And it's the growth factors that allow the stem cells then to regenerate in tissue.
I'd love to know how they got the idea to actually use electromagnetic energy, but maybe for another day.
Well, if you want to, I have a very quick story about that.
Yeah, keep it 30 seconds.
Okay, so what happened is, as the space capsules went around the planet, they discovered that they had what they call a generator, a cell generator. And they found that the cell generator had spurts of growth at the polar regions. And as we know, the polar regions have a lot more energy, electromagnetic energy in them. So the AHA came up and said, okay, well, can we duplicate what happens in space going through the polar regions, which is unreliable. And of course, once you're out of there, then it's not doing anything.
What were they growing, Bill? What were they growing in the
stem cells? Stem cells.
So this was independent of them adding external magnet. Yeah, I got you. I understand now. Okay. All right. Now let's fast forward to concerns about what's on the market. There's just, you can go on the internet and you can see a gazillion different choices. So how does the layperson and even the doc decipher through this claims and know what's relevant, what's BS?
So after 30 years of working with magnetic field therapy and having reviewed thousands and thousands of research studies, what we've concluded, including evidence from that NASA study that I mentioned with the stem cells, the most important factor with magnetic fields is not the frequencies, not how fast it's pulsing, but the actual intensity of the magnetic field. That's the critical factor. And so what happens is that most of the devices that are out there don't even consider that. If you're going to buy a PEMF system, you better be asking the person who's trying to sell it to you what the maximum intensity is of that magnetic system. If they can't give you that answer, I wouldn't buy it, because then you don't know what you're buying. Research is showing that for inflammation purposes, you need a minimum of 15 gauss at the tissue. And because magnetic fields, like sunlight and like heat and cold and so on, drop off very rapidly from the source, magnetic field therapy does that too. So you have to calculate the dose basically on where you're trying to treat. So if you don't start with 15 gauss, if you start less than 15 gauss, you're going nowhere in terms of reducing inflammation. And most of the problems in the body are associated with inflammation. So a minimum of 15 gauss, ask what the intensity is.
What is
the best website,
translationally though for
for
shorter units of time where you're not wearing these things as wearables? Give us a ballpark. Are we talking about look for something, you know, if you're looking for shorter increments, 200 gauss? What are we talking here, Bill? Roughly.
If you're looking for just health maintenance and just relaxation and so on, then anything less than 15 gauss is fine. But it's got to be a minimum of 15 gauss at the surface of the skin. So if you're trying to treat anything deeper into the body, including influencing the brain, then you could probably be best off with something a minimum of 200 gauss. You can certainly go higher.
In your opinion, if we have like, there's a brand called Omni that I looked up the other day. If that has between, let's say 1 and 4 gauss, that's a non-starter as far as what we're likely to accomplish with big health benefits.
Well, for relaxation, it can work for that. It can work for stimulating the acupuncture points in the body on the surface of the skin, but it's not going to do any kind of deep healing work. That child with the thumb, she was using 200 gauss.
Or the bone fracturing,
bone generators are
or more intense recovery for muscles, like I've been doing with tendon strains, etc. So I think the watchword here is intensity is king here. We have to have the proper intensity.
Correct.
On the other hand, we might not need to spend $50,000, $60,000 either. There are units out there, and that's why they need to get your book, Bill. What is the name of your books and how do people get it?
The latest book, if you want the science, the book that you have to get is called Power Tools for Health. If all you want is to be able to be told how to buy a system, how to use a system, and what system to buy for yourself, then the Supercharge Your Health with PEMF Therapy book is the one you should get. And that gives you guidance in terms of what kind of system. That Supercharge Your Health book gives you guidance in terms of what system to get for what you're trying to accomplish.
And you and I have a companion video that we made together that is going to be available. I'm going to, in the stuff here on the description, for the YouTube description, I'm going to leave the information as to how to get to that, where you break it down step by step on the tables, how to do the calculations so that you know you're getting the deep penetration for, you know, a thigh strain versus something very superficial like maybe neuritis of the distal toe. So you break it down step by step, and I think it's for anybody that has relative scientific background for, you know, science in college, you'll be able to understand it. All right, what about safety concerns, Bill? Everybody throws out, oh my gosh, this thing's going to go to my liver. I can't have something on my foot. I'm very scared about getting this type of electromagnetic therapy. What do they need to know that you can give them some sort of solace with that?
So the safety concerns that we have the most have to do with EMFs, and that's microwaves. And microwaves do cook the body just like we cook food in our microwave ovens. That's where the risk is. Magnetic field therapy that we're talking about is extremely low frequency. It's way below that, and it doesn't broadcast into space. It basically opens up and closes down as the current passes in a wire.
So do we call that a closed loop, Bill? Is that called?
I call that a closed loop system. Correct.
Right.
Now, safety has been well established with PEMF therapy. There are PEMF therapy devices approved to treat the brain that are about 6,000 or 8,000 gauss, and they're strong enough to cause muscle contractions. So you treat one part of the brain and you look for muscle contractions in a hand. That's powerful. And they use even higher intensities than that to treat the brain. And that's been well established to be extraordinarily safe.
At the same time, I mean, if you're looking into doing more specific work, there are physicians that specialize this. In fact, the FDA has recently approved one for depression. That is under the guidance of a physician, and it actually maps out the central areas of the brain where that electromagnetic energy needs to go. So this is not something that you can just snap your fingers, get your local system and just try and see what happens. You really need to be specific, especially with that type of work. All right,
Well,
so I
if you
think
do
we've
that
got
kind of work, then you do have that gives you an FDA indication. What we're talking about is wellness equipment. We're not talking about medical equipment.
Right. And you referenced why the bone stimulators that we use with insurance are so expensive. Why is that, Bill? Why are they so expensive?
Bureaucracy, administrative costs, getting FDA approval. It takes a lot of
Thousands of
money to get
dollars.
Something.
Thousands of
Not
dollars.
thousands,
So
millions
it
of
makes
dollars.
a $200 device become $2,000 because of all the time and regulation.
Or a $10 device become a $2,000 device.
And then what about the opposite end of the spectrum, where we have stuff that's out there that has not sought FDA approval, that's kind of borrowing some of the technology that has already been proven?
So if you don't make claims, and if you understand the technology, once you understand magnetic field therapies, I could look at a machine, I could look at the specifications of a machine, I know what it will do. I know what its limitations will be, and I know what its value will be. So if you have that understanding of the electromagnetic fields, you don't need that kind of approval. Now, if I'm making a claim like they do for the brain for depression, if I'm going to make a claim that I'm going to treat depression, then I need to get FDA approval.
Where are the best meetings happening for physicians that are interested, both virtually and then also around the world, in terms of where's the big electromagnetic centers of medical conferences happening for people that want to learn more depth and detail?
I wish I could say there were. I used to be the vice president for the North American Academy for Magnetic Field Therapy, and that organization went defunct. And we had annual conferences. Doctors would come in,
Funding,
learn all
funding
about
issues.
But there aren't anymore.
Okay, so lack of funding because probably some companies would rather sell a drug. I imagine that's some of it. What were some of the other challenges?
Well, again, because it takes a lot of money.
Yeah.
And the magnetic machines that we're talking about, the right ones, the best ones, are not made like paper clips.
Right.
They're usually made in small quantities, and so the cost clearly goes up.
Yeah, you're talking upwards of several $1,000s up to 10, 20, 30, $40,000.
Exactly.
Yeah.
Correct.
Yeah.
Well, the brain stimulation machine that you mentioned, that costs about $50,000.
Right.
And there are devices available for the practice setting, and I think you have one, that are higher intensity, but they still cost tens of thousands of dollars. But we now have them available
Bill,
for less money than
if
that.
people want to contact you, how can they reach out? If they have questions about some of the information you have, and then also you have some vetted products that you have in a portfolio, how would they reach out to contact you?
Well, one of the first things to do, clearly for the saving money, is to get one of the books, and preferably the Supercharge Your Health with PEMF Therapy book. The other way is to look on drpawluk.com, drpawluk.com. There's a huge amount of information there. And for people with some significant health issues that are willing to spend the money that they want to get the right equipment to help them with their health issues, then there's a questionnaire they can complete and get a free consultation.
Thank you so much for spending time with me here in the middle of both our clinic days. I wish you continued success. I'm sure we're going to be interacting in the future. I look forward. You're right up the road from me in Baltimore. We're going to grab lunch or breakfast sometime. And best of luck. And I'm going to share my clinical experience as I continue on YouTube. And we actually get comments right from the patient. So go to my FitFoot channel to find out more about electromagnetic, and I'm right here in Arlington, Virginia for consultation. Thank you again, Bill. It's been a great interview.
Thanks for inviting me. Pleasure to chat with you and share information.